Welcome to the story of every man. Tonight's guest is Vern Rennier. He's the CEO of Oceans Healthcare. Welcome, Vern.
Thank you. Thank you. Happy to be here.
Thanks, man. Now, Vern, I do ask every guest, do you remember how we came to know each other?
Longview Connections, I think, is where I first met you at.
Absolutely. That is correct. I don't think I knew much about you before that, but it was really cool to meet you, meeting everybody there at Longview Connections and getting to know you more. Uh, I've really enjoyed to hear your story and hopefully we'll share a little bit about it
Yeah.
today. But yeah, I really have enjoyed to get to know you a lot more here recently. Now you're not originally from Longview, right,
No,
Vern?
no, no. We moved here. I've been here for just a little over a year now.
Okay, from where?
Alexandria, Louisiana.
Louisiana.
Yeah.
That's pretty cool. That's not too far away.
No, yeah, it's a few hours.
Yeah. Do you like the move?
We love it. We love it here in Longview. We love the community here. Just everything about this place. We're really welcomed in. They took us in with open arms, and really, my wife, my kid. We moved my kid in here, and she's at Pine Tree Junior High, and just really thriving. I mean, this is just a great place to be.
Great, great. Now you're the CEO of Oceans Healthcare. Tell me about Oceans Healthcare.
Yeah, so we're a behavioral health hospital. We have an inpatient unit where we take care of patients who are 50 years old and older, who suffer from mental illness, who are in a crisis, and we have 24-bed hospital. And I can tell you that's probably not enough. Like I think eventually we're going to have to open up some more beds. We also have an outpatient facility. We actually had to do some construction there to open up some more space because of the volume that we really started to get in. A lot of that when I first got here, a lot of people just didn't know we existed. They didn't know what Oceans Healthcare was, didn't know where we were at, and getting out into the community and having some speeches and being able to talk about mental health and my story, getting it out there, I think has opened the door for a lot of people to really want to come and, oh, I didn't know that was here. We thought we had to go to Dallas or we thought we had to go to Shreveport. And we have that. We have the very best of healthcare, mental health care right here in Longview. And so as everybody started hearing more and more about it, more and more people started to come and get help. And, having access to care is something that's extremely important. To know that we have that right here in our community. And when I got here, I started just asking questions. Me and my wife would go to shopping, or we'd go to the restaurant, and I'd ask the cashier, I'd ask the waitress, I would ask all these people, "Hey, have you ever heard of Oceans Healthcare?" I swear I asked about 100 people, and nobody had heard. I mean, not even one person said, "I think I heard of that."
I
And
was I was in LCDC for 13 years. And I knew several of the different, not necessarily mental health, but
yeah,
substance abuse and things of that nature. I'd never heard of Oceans,
yeah,
which is so weird.
yeah,
How
absolutely.
long was Oceans around
So
before?
Oceans got here in 2014.
Wow,
Yeah, it's been here that long, and
wow,
nobody. It's like a hidden secret, a hidden gem, And I was like, we got to get this secret. We got to get this gem out there so people can know that we're here, and we can help support people who are suffering from mental health. And I think another thing about us that is unique is we don't work in silos. We want to make sure that we're a resource. We might not be the exact place for every single body, but we're going to refer them somewhere where they can get help if we're not the right place for them to go. And I think that's extremely important when you work and you collaborate with other organizations to share these type of things, because if we didn't know that Oceans was here, then there's probably a lot of great things that other people don't know exist. But if we work in collaboration, then it opens the door for a lot more resources for people to know about and to get help for.
cool. Uh, and we'll circle back around to that.
Sure.
You took it over. How long have you been there with Oceans?
So I joined Oceans April 21st of 2025. I got recruited here from Christus St. Francis Cabrini Hospital, where I was a director of operations there. I went through I was interesting story. I started healthcare January of 2020, just right before COVID hit, and I started as a security director. And I'll share a little bit more about my story. But I got into healthcare as a security director. All of a sudden, COVID hit. Right, I was like, "What is this?" And so everything that was normal in a hospital just became different. And so we really beefed up the security out there. We did some new things, some different things, kind of ideas that I had that we ran with, and I ended up getting the attention from Catholic Health Magazine, and they wrote an article about me because we didn't have any incidents. We really honed in on what we were doing, making sure that people were safe, and we had to lock down the hospital where only patients could come in, and family members couldn't come. I mean, it was COVID, I don't have to really go into detail, was a very, very challenging time for so many people in the world.
Yeah.
And, just coming up with ways to make it easy for our staff to feel safe, for them to be able to do their job, for the patients to feel safe about it. And, and I got the attention of the CEO once they wrote that article about me. He brought me in, and I have an MBA, and he brought me in. He said, "Look, I know your story. I know you got some mental health, some post traumatic stress and things like that." He said, "What I want to do is I want to get you into our behavioral health." He said, "I'm losing $1.5 million a year on this unit." He said, "I can't afford to pay $1.5 million to keep it going, but we really need this in our community. If you can just break even on it, then that's going to be a huge win for us." So after the first fiscal year, I surpassed that. Not only did I break even, but we profited $2.15 million.
Wow.
And so that got me an opportunity to go to the Leadership Academy for Christus Health, which is called LEA, stands for Leadership Ethics Academy. And they really got a lot of training throughout that program. It's a great leadership class that Christus has. When I graduated the program, became the director of operations, and so then I had multiple departments that I oversaw. And opportunity came up, and Oceans had reached out to me earlier on, and I interviewed with them and really got to know what Oceans was and what it was about. And it was a hard decision to leave Christus Health after investing all of this into me and
Right.
really giving me a career in healthcare. So I turned it down the first time, and I
Uh,
think they were going to send me to like Midland or somewhere like that. And then me and the CEO of Oceans, the healthcare, we have 39 hospitals around the country, and so the CEO over the entire organization, Stuart Archer, we connected again in December of 2024, and he said that there's some opportunity in Longview. Kind of gave me the rundown, and and more I thought about it, the more I researched about it. I decided to make the change, and there was not very many organizations that I was going to leave Christus Health for, but Oceans was going to be one of them. It's my passion to help others who have mental health care. I've been through that patient experience as someone in the military going through post traumatic stress disorder, depression. I knew what it was like to be that patient, and I wanted to, and having the opportunity to help people was in a mental health space was just something I think was just really high on my list. When I started in the behavioral health as a director, I really enjoyed that job a lot. And then as I kind of climbed the ranks pretty quickly there at Christus, I no longer really oversaw the behavioral health part because I had so many other parts of the hospital that I kind of oversaw. And having an opportunity to step back into a role, be a CEO, where I would have a lot of autonomy on getting patients into the hospital, letting them people know that we're here, and providing excellent comprehensive mental health care, I think was just extremely important for me. And so it was easy for me to make that decision, and here we are. There was a lot of things that happened. I don't talk a whole lot about it, but spiritually wise, there was a lot of things that had to align in my life for me to be here. And if none of those things would have aligned for me, I wouldn't be sitting here talking to you right now. Some of those things were very challenging that I didn't think were going to be able to happen. But God, when He's working with you, and I think He makes things happen for you. He puts you where He wants you to be. Sometimes you're not always where you want to be. And so when I was looking at the opportunity of coming to Oceans and coming to Longview, I had a house in Alexandria, And I tried to sell it a year before, and I could not get anybody to even come look at this house. Like, nobody even came and looked at it, much
Right.
less trying to make me an offer for it. So that was gonna be a stressful thing. Like, okay, how am I gonna live in Longview and then still have a mortgage in Alexandria, you know? And um, we were going to put it on the market on a Monday. And Thursday before that, I actually had somebody from my neighborhood come and actually offer me for my house. He said, I heard you were leaving, and I wanted to see if your house was going to come up for sale. The guy bought my house. I didn't need a realtor. I didn't need anything.
Oh,
He
wow.
used his attorney, and man, we closed on the house. It was the easiest sale I've ever made. Uh, yeah, so
That's a
that
done deal.
that was a huge challenge that I didn't think we were going to be able to overcome. That we came through. I really hate to put negativity in out there, but I have a 13-year-old daughter, and my ex-wife is a police officer back in Central Louisiana, and her husband is a police officer. But there's still a little bit of abuse in that house, and so I was concerned about leaving my 13-year-old daughter in that house. Me being 3 hours away, and if she needed me, I was like, "How am I going to do this?" I went to my attorney. I said, "Look, I want to apply for full custody." And he's like, "Vern, look, I love you to death, man. She's been with her mom all these years. They're police officers. Like there's no report of abuse going on in the house. You're moving out of you're not only moving them out of the school, you're moving them out of the town, you're moving them out of the state." He goes, "I love you, but it ain't gonna happen." I said, "Well, Greg, let's just do it anyway. I want them to know that I'm going to hold them accountable if there's any abuse going on in that house." And so we went to court, and I'm happy to say that I have full custody of my daughter. And that's God. All these things are kind of aligning in my life. My wife was able to get a great job here in East Texas at ETBU as a professor. I mean, it happened like very quickly. She went from having a job at Louisiana Christian University there as a VP and getting a business professor, kind of running the MBA program over there in ETBU. So, I mean, so many things are really aligned for me to be here. And when you allow God to use you as a vessel, I think that, anything is possible. And so that's how I look at what I'm doing today is just allowing Him to use me as a vessel because I'm meeting people like yourself. I'm meeting a lot of great people out there. I'm really not that smart. I'm really not that charismatic. So it's just really it's like God's working his ways for me.
Yeah. Going to court to get full custody, was it a battle or did they make
Oh
it
no,
pretty
it was a
pretty easy?
battle. Oh
So
no,
it
oh
was a
no,
battle.
yeah,
Yeah.
yes,
We don't have to get into
yeah,
it, but okay, I was just
yeah.
curious.
It,
I
it
was
was
just
a it
curious.
was a it was a bad battle. As a matter of fact,
Okay.
it was 3 different days,
Uh-huh.
and they ended up the first day. The judge thought that it was going to end right away. He's like, okay, I know how to settle this. Quickly realized there was more to the story than what they initially found out. So then they set a date where it was going to be us all day long, and so the
Oh,
whole
wow.
day it was our trial. It didn't finish there, so they set another date a month later. We came back, and it ended. And I'm not joking. This is a great judge over there in Grant Parish, but it ended at almost 9 o'clock at night when he made his decision,
Oh,
and it had
wow.
been going all day. And it ended up in my favor, and obviously I couldn't be happy enough. And my daughter's thriving, making great grades. Pine Tree Junior High is a great school. I'm sure there's other great schools here. We just happen to live in a neighborhood that is near Pine Tree, and I mean we can't ask for a better school.
Great. Well, congratulations on getting her for full full
Yeah.
custody. So tell me about uh, how you ended up like deciding to go to the military and what happened there and how you ended up
In healthcare, how did I end up in
well
or
just how you ended up with PTSD,
Sure.
just
So yeah,
how you went to the
yeah,
military.
I joined the military when I was 17 years old, right out of high school. Didn't know what I didn't really think that I wanted to do college first. I thought that I get the GI Bill, I'd be able to go to college. Well, they don't tell you in the infantry you ain't got time to go to college. Infantry is something I really wanted to be. It's a family. I had family tradition. My grandfathers were infantry in World War II, so I wanted to be infantry.
What
Um,
branch
I was in the
in
army.
the army? Okay.
Yeah, and then I deployed to OIF 3, Operation Iraqi Freedom 3, in 2004. Did a tour there. I got wounded, lost some teammates. I ended up in Brooke Army Medical Center, BAMC, which is in Fort Sam, Houston there. And I was in there getting recovery. I had traumatic brain injury, had some surgery on my back and my knee, some shrapnel removed from me. And I went through, as luckily as I was, the Army, when you're in a wounded platoon, what they do is your job every day is to go to your doctor's appointments. They give you a schedule, and this is your doctor's appointment. That is your job every day in a wounded platoon, is to make your doctor's appointments. Well, they had mental health in there. And so I went and started getting mental health treatment early on, which really, I think, set me up for success. Because if I wouldn't have gotten that, I think the road that I would have been on with my depression would have put me in a different place.
Was that an option?
No, it wasn't.
You had to
No,
go to those.
yeah,
Yeah.
they give you your doctor's appointments, and look, the Army tells you when to eat, when to sleep, when to go to your doctor's appointments. Apparently, so yeah, your job was to go to the doctor's appointment. You didn't miss those appointments, and when I started out, they did give me an option here that I was didn't really think they would. Is when I started mental health treatment, it started individual treatment, and the counselor had told me, he said, "Look, I want you to go to group therapy." And I told him, I said, "I don't even want to do this individually, much less do I want to go talk about it in front of a bunch of people."
Yeah.
So he ended up talking me into just trying it. He said, "Just try it out. Try it for a week. If you don't like it, we'll come back to individual. There's no problem." He goes, "I guess for some people, groups may not be it for everybody." But he said, "I think you'll get a lot more if you go to a group therapy." I said, "All right, I'll give it a try. What am I going to say? No, they're going to make me go anyway." So anyway, I'm in group therapy, and the first 2 days, man, I'm sitting there listening to everybody. I didn't want to say anything. I didn't want to be part of that, And but the third day, somebody had said something to me in there, and it just resonated with me. And I'm like, wow, And next thing I know, I actually talk about it. Next thing you know, I'm in this group. I'm having conversations in this group just like everybody else. And what I learned really shortly is that was other people in there that were going through a lot of the same experiences that I was going through, a lot of confusion and a lot of depression. And I'd never been depressed in my life or had PTSD. I didn't know what any of that meant, but I knew that there were people in there that were in the same situation that I was in, and that really opened the door for me to kind of open up and really get the help I need. Look, 21 years later, I'm still friends with some people that were in that group, and we helped each other over the years get through some tough times. Being depressed and suicidal is a real thing, and that's not really something that you can really handle on your own. I mean, you're gonna have to really open up and be able to go out there and get help for it, or it's gonna continue to spiral downward.
Going through having PTSD and depression, did you ever become suicidal or have thoughts
Oh
of suicide?
yes, yeah. I became suicidal multiple times throughout the years, but I stayed in therapy. I stayed in treatment. I came to a crossroads in my life, and said, if I do this, then everything that I've ever done, me still being alive here, all that would have been for nothing. And so I made it a point, and I had kids too, and they were always on my mind. But I'm gonna tell you, for those of you, when I sit there and say I have kids and they were on my mind, there's people out there that have committed suicide that the kids were the most important thing in their life, and they still probably were till the day they died. Depression and suicide is a real thing.
Mhm.
Unless you're out there to get help, unless you can get some medication for it or talk about it with some real professional counseling, it's really hard to overcome on your own. You can be tough muscles, but that mind up there can be a very tricky thing to have to get over on your own. And some people can come out okay on their own, but I think 9 out of 10, you're really going to have to get help in order to get through that.
What would you tell a person who, first of all, congratulate or thank you for your service?
Yes, sir.
Do you still you said you got injured. Do you still deal with some of
I
those
do.
injuries today?
I do. I do.
Yeah.
I deal with those injuries. I can't see out of my left eye. I had a piece of metal that went into my eye there. I still have a really bad back trouble, and PTSD is something that I still deal with to this day. I got a great wife that she sees the triggers in me before I'd even notice them, and she helps me navigate those. And that's very important to have somebody in your life that can help you and to get through that kind of stuff instead of thinking that it's you use it as an excuse. I mean, it's not an excuse. It's mental health is a real thing, and those suffering for it, like I said, you got to go out there and you got to get some help.
What do you tell people who say, I don't think it's that serious? Like, you're making it more than what it is.
Yeah,
Depression and or
sure,
suicide.
sure. The way I look at it is this: mental health is just a health issue, right? It's really no different than your blood pressure when you look at it as a health issue, and you take out the stigmas out of it. And I've never had anybody say, "Hey, I'm embarrassed because I'm going to see my primary care physician because my blood pressure's high." I've never in my life ever heard somebody say that. And when you look at mental health and depression and you look at your blood pressure, in a lot of ways, it can be similar if you look at it in a health issue because I have high blood pressure also. In order to control my blood pressure, I have to see my doctor. I have to take my medication. I have to eat right. I have to sleep right. And I have to exercise in order to control my blood pressure. Well, control my mental health. I have to see my therapist. I have to take my medication. I have to eat right. I have to sleep right, and I have to exercise in order to control my mental health. Wow, that's pretty close to the same thing there.
Mhm.
So we need to get to a point as a society and a country that we just break down those walls of stigma. Look at this thing as a health issue. And if you feel like you got high blood pressure and you go see your doctor, you feel like you're sad, you should probably go see a doctor. This should be looked at the exact same way and no different. If you're sick, you're going to go to the hospital. If you're coughing, if you're sneezing, you got strep throat, you're going to go get treated for that, and you're not going to be embarrassed about it. And that's how you should look at mental health because it is a health issue. No, really, no different.
You said so earlier on in life. Did you fall to that where I don't want to be seen as this or that early on when you were having to deal with this stuff?
I was confused. I just didn't know really what it was. It's not something that I'd ever dealt with in my life, and
So you necessarily didn't like shine it away. You just were confused about it.
yes, I
Okay.
was very confused. I knew that there was a lot wrong with me. When I saw my wife and my sons for the first time, there was a feeling in me that it really. I was like, I should be happier to see my kids and my wife. Like, why am I not happy? Like,
You
what is
recognize
going
it.
on with me?
Yeah.
I recognized it right away. As soon as I saw them, I thought that it was going to be a different type of celebration,
Right.
but it wasn't. And it was a lot of confusion really surrounding that, and I didn't know why. And until I started getting help and therapy for it.
Do you feel like the military did a good job in helping you out coming out of there?
I think they did for me because I got being wounded and going through a wounded platoon. You kind of didn't have a choice going through that. But if it wouldn't have happened for me that way, then listening to other stories, so not being able to really give you a firsthand experience, but listening to other veterans speak, and a lot of them speak in the same way, is that they felt that they didn't get the help that they needed. They felt like if they were infantry or if they were a military police officer, and they said that they had issues with PTSD, they might get reclassified. They may not allow to be carry a weapon anymore, or they may be discharged. And so a lot of them just didn't say anything, and had to deal with that. And when they got out, it just got worse.
Yeah.
And it's like I was telling you, if you don't get help for it, it starts to spiral. And it's almost like things start to stack up on you. One thing happens as bad, and it's like it just keeps stacking up on you, getting worse and getting worse and getting worse, is because you're not getting that true help that you're needing. And same thing when I talked about high blood pressure, right? If I don't control it, it's just going to get worse. It's going to lead to me having a heart attack or a stroke, and I end up inpatient with a heart attack, and now I got to get rehabilitation there. Well, if I don't control my mental health or depression, then I'm going to end up in an inpatient hospital to try to control my crisis that I'm going in, and then I'm going to need therapy after that for like rehabilitation to get back to where I need to be in my baseline with my mental health.
And I don't know if you know specific numbers to Longview, but what does that look like in Longview? The suicide rates or You know.
I haven't specifically looked into how many are suicides we have in Longview, but I know in our area we have a lot. And I listen to some of the high school counselors that tell me about the teenagers that have committed suicide. I'm hearing about veterans because I'm getting in the big, we're in the veteran community doing a lot of things for veterans, and I'm hearing a lot of suicides that go along through there. I just did some talking. It carried the load up in Mount Pleasant and Mount Vernon, and there was a lot of signs up there, and a lot of them were from veterans that come home and committed suicide. That's just something that we need to control. I've lost more teammates coming home from Iraq to suicide than I did while I was in country in combat.
Yeah.
And that's just something that we have. It's something we can control, and it's something that we need to control. And it really starts with breaking that stigma.
Do you see just the the best knowledge that you have? Do those that come out of the military and do that, are there signs, or is it just an immediate occurrence?
I think the signs are early on. Being able to recognize those signs with yourself may be a challenge sometimes. It's a lot of confusion. It's like, well, I don't understand this, and then it just gets worse, and it's like things just start piling on it. Like I told you, and I think it leads to that point in your life.
Yeah. Do you, did losing teammates? Did you get close with the teammates that you
Oh
lost?
yeah, when you're training with guys, you're doing everything together. You're going out together. I mean, you don't have really friends outside of the military outside the base. You don't go hang out with people. Everybody you hang out with is there on the base. They're in your platoon. They're in your squad. They're in your barracks. You guys are hanging out and doing everything together. You're training. You're eating. You're sleeping. You're doing all those things together, and you're just real close. And so when someone dies on your team or in your platoon, or it's like losing a brother. It really is. It's like somebody that you grew up with, your whole life, and it's a void that you can't take back. And being going through experiences like that, I can tell you in my PTSD experience, when you think back at some of the things, it's almost like it happened yesterday, and it's 20 some odd years ago. Sometimes smells still come around. I can tell you, when I drive under an overpass, to this day, I'll always look up at the top of that overpass. When we were in Iraq, sometimes when we would go under an overpass, they would try to throw grenades down on us. They would shoot at us from up top of the overpass. And I know ain't nothing up in any of these overpasses, but I still look up at them every single day. I can't help but to do that. And
Mm-hmm.
that's just, it's almost like it was yesterday. And one minute I'm in this situation, next minute I'm here. And I think that that is something that will never go away. But what therapy will do is give you life coping skills to help you control that and help you navigate some of those things, so that you don't always think about it. You don't always have bad days. My life coping skills is really consuming myself into my work. I have a passion for what I do. Obviously, I don't do this for money. I don't do this, or I wouldn't have left where I was at. Because I don't make $1 million a year
Yeah.
doing this, right?
Yeah.
But I make $1 million in my heart because it's my passion. Whenever I'm seeing people who have come through our program, and I see them out there in the community, and see how well they're doing and how they're thriving, and they come up and they'll hug me and they'll thank me, and man, that just is more to me than any kind of money that you could possibly give me throughout the rest of my life. Those are the kind of things that really keep me going, and keeping me knowing that, hey, this is what I'm here for. This is what I want to do, is getting the word out there, breaking that stigma, so that people can come out there, really truly get the help they need. Because everybody, I don't care who you are, what you've been through, everybody deserves to be happy. Everybody
Right.
does. And, sometimes you just need that little extra support in order to get you there.
Oh. Now, you helped. Correct me if I'm wrong, but you helped Longview gain the title of a veteran friendly.
Yeah, so I'm going to talk about that for a
Yeah.
minute, because I definitely don't want any credit behind that. Longview itself was already doing all the things in place to get that accreditation. Only thing I did the application, right? I
Yeah.
just did the research, found out everything that Longview was doing, did the application for Longview, and then they got recognized for it. So very happy about that. Very good opportunity for the veterans here. in our community and the surrounding communities that we got that veteran friendly community designation.
You were, if I recall, you had said at some time like veterans were leaving Longview,
Yes, so there
and
were
this is
numbers that yes.
and this is gonna should help.
This is going to help a lot. You know, this is an opportunity where veterans can see that you're a veteran-friendly community here in Longview, and that what that means to somebody is that you have resources here for them and for their families, and you do things for veterans here. There's discounts that are offered all over the place. Go Bus, I think Ed Cog got Go Bus, free rides for veterans. There's just so many different things here for the community just really accepts veterans here, and it's so exciting to see that, to see people thank me for my service, because I know that they're doing that to all the other veterans, and they truly deserve that.
Yeah,
To go through what they went through and what we went through over there, to come home and be appreciated for, that's really all we ask. And you know, I'll never go into a place and say, "Hey, I want a discount." I never do that, but people offer me a discount. They can look at my haircut and say, "Hey, were you in the military? You a veteran?" You know, and saying I always carry my Purple Heart. You know, that really means a lot to me, and a lot of people can see that and they identify with that. And having that, having veterans being able to get discounts and have opportunities to thrive, I think is extremely huge. Some other things that we're working on too that I think are very important is we're looking at like a place where veterans can have a one-stop shop here. We're looking at Operation True North with Grace leading that over there. We're looking at doing a one-stop shop where a veteran could come in. We're going to have somebody that's going to be able to write benefits for them. We're wanting to partner with East Texas Food Bank and possibly be the 10th distributor in the city here.
hmm
Looking to get East Texas Workforce Commission in there so that they can turn veterans DD 214s into civilian resumes. There's a lot of transferable skills over there that can really help them find jobs.
is that not possible right now, or
Yeah, you know, a lot of veterans have have hard times trying to find jobs. There's a lot of
but they have the
stigmas around it.
skills? They just
Yeah, they have a lot of transferable skills. I mean, we have the greatest military in the entire world. Why would an organization not want to put a little bit in their
exactly,
organization, you
exactly.
know? And I think it's just connecting the dots. It's just getting these veterans in there and showing them what job opportunities are available, getting those resumes put in so that the employers can see what they're getting. I mean, you're getting somebody with a lot of discipline, somebody that's going to be there on time, that's going to be there for you and going to be a hard worker. So you know, I think there's a lot of opportunities there. We're also going to partner with the Longview Chamber. We talked to Dave and Kelly about possibly putting a veteran committee together for the Longview Chamber to kind of help the veterans who need or looking for jobs as well, or even starting as an entrepreneur. You know, there's benefits that the chamber can have for somebody that is wanting to start up their own business.
Yeah,
And also in the one-stop shop, we're going to have someone that can write insurance is another big thing for veterans. When they apply for their benefits, a lot of times it's going to take 6 months to a year, maybe longer, depending on the veteran being able to get everything that they need for those applications and benefits. So we need to make sure that they are able to eat, make sure that they're able to get a job, have insurance is extremely important for them, and then being able to apply for their benefits. You know, those type things are going to be initially what we're going to start in there because that's the need really around here. So we're really excited about that and partnering with it to kind of get that one stop. They can go to one place and get all of that help right there in that one spot.
yeah. That's really cool. That is a lot. That is a lot to bring and to try to put together. And I think like you were saying earlier, Oceans was a hidden gem. I think maybe you found that Longview's already giving all these things to veterans was probably a hidden gem. So he's like, let's
Absolutely,
just give them the
absolutely,
accreditation that they deserve for it.
absolutely,
You know,
absolutely.
it just sometimes it takes an outsider to come in and see that, right?
Right,
And or somebody who can see it
right,
from a global view.
absolutely,
So I do agree that there's a stigma with a lot of things, right?
right.
And I I really don't know the right words to say to any one individual. I mean, other than just like give it a shot. I mean, to go talk to somebody if you're having an issue.
Just like they did me, trial it, right? Just go
Yeah,
trial it
yeah,
and see how it turns out. Give it a week, give it 2 weeks, and see if you find any improvement, see if things work. Sometimes you may need medicine, and I'm telling you, medicine sometimes takes 10 days or so to start to get into your system, to
yeah,
start to work for you. So you're going to have to give it just a try and just see how it benefits you. And you're going to find that it's going to really change your life
yeah,
if you truly give it a chance.
yeah. What about people who are less fortunate? How do we help them who are going through this but don't necessarily have the means? Is Oceans able to help?
Yeah, absolutely. We take every insurance there is, including Medicaid, Medicare, and if you don't have any insurance at all, we there's a lot of nonprofits out there. We refer you there. You're not going to come to Oceans. You're not going to call us. You're not going to come in our door and not get a referral somewhere else if we're not the right fit for you.
Right.
We're just not going to allow that to happen. We're going to make sure you got somewhere to go.
Gotcha. So you shared a lot about the military in terms of what occurred and how it's affected you. What's one of the most positive things that you got out of going through the military?
Who I am today. I mean, I wouldn't be where I am today. I think I went through everything that I went through. God's put me through a lot. And, I think that He put me to endure all that so that I can be as passionate as I am about what I'm doing. Because if you don't experience it yourself, you don't truly know.
Mhm.
And I've been that patient on that side, so I know what people are going through and how you can get through that. Like, you can get through this, just like you can get through your blood pressure. You can not have a heart attack when you take blood pressure medicine. When you treat your blood pressure, you can not get to that point. Same thing with mental health. You can not get to the point to where you're suicidal, or you can control and manage a lot of the bipolar, the schizophrenic. A lot of that could be managed. There's life coping skills behind it, mind and memory care. There's a lot of things that we do and that others provide to help people who have mind and memory problems. Those that have traumatic brain injuries, those that have had brain surgery and things like that, where they're not having the being able to remember everything. Could be a real problem, a real challenge. If you take blood pressure medicine and you take it and 15 minutes later you can't remember if you took that or not, that could be very dangerous for you.
Yeah.
If you go in there and you try to take it again. So there's life coping skills that can teach you how to manage your day-to-day life, while still having memory loss. And so,
What do you do for leisure time or for yourself?
it's a great question. So my wife would laugh at this. I'm a car guy.
Oh, yeah?
Oh yeah, I love cars. I love taking a car, and it's almost kind of like, I take a car that is just average or needs some tender loving care, and I take that car and I just make it as nice as it can possibly be. And I enjoy waxing a car, really cleaning it up. Putting my spin, my touches, the wheels that I think is going to look great on that car, that kind of thing. Ordering parts, waiting on them to come in.
Does she sometimes give you like does she sometimes give you grief about, oh, that's not gonna look good? That's not gonna look good. What's wrong with you?
Yeah. So my taste and her taste are different, but the end result, she's like, "Oh yeah, that looks great." But she didn't want to, initially say that. She didn't. I think early on when I started doing that stuff, it was kind of costly.
Yeah.
But I ended up always being able to sell them and get my money back, and I think that's a little bit of a life coping skill for me in mental health. Is I take these cars, I fix them up to the best I can possibly get them, make them look absolutely beautiful, and then I sell them so that I can start all over again.
Yeah.
And I've had so many cars in my life. I mean, I can go through an album of pictures of the different cars that I've had. But that's just I think that's just one of my life coping skills.
What's been your most memorable flip?
Man, I had a 1967 Mustang, and it looked like it was green and red when I got it. This thing looked like a Christmas ornament or something, man. And had just like any old '60s model car, had rust on it and everything. So I put a lot of stuff on it, but I had to bring it to a body shop because there's a lot of things that I know that I just can't do.
Yeah.
I can't paint a car. I'm not really good at welding or anything like that. So my buddy who owned a shop in Alexandria, he got all the rust out and he painted this car. It was absolutely stunning when it was done, and it had a 302 Boss in it. We took the engine out, painted the engine compartment, painted the engine,
Wow.
powder coated it. I mean, this car was just beautiful. And I have pictures of it here. We won some
Yeah. Do you
car
have a
shows with it.
before and after?
Oh yeah,
Yeah.
oh yeah. I'll show you the Christmas tree and then the after. And I think that was my very favorite one.
Wow.
But I have cars on here that I'm like, man, I wish I wouldn't have sold that car. But it's just, I think it's part of my life equipment skills is just take a new one and do the same thing with that.
Yeah.
Continue on in that. I'm not making money off of it because what I make off of it, I'm just spending it back when I buy another car
Yeah.
and add all the parts. So
Just a
it's
cycle.
just having
Yeah.
that, being able to order the part and then waiting for the part to come in. It's optimism. Like I can't wait for that to get here so that I can start working on that, and create time in my schedule to start to work on it. It's just, I don't know, it's something that I think, I get some joy out of.
Has that carried over to Longview? That's something you do?
Oh yeah. Oh yeah. I have yeah, I have a couple of cars in the garage now. Yeah.
That is
So,
cool. Man, that's pretty nice. What about I know a lot of guys in the military, they like firearms. Are you still into firearms?
Oh
or
yeah.
Did you collect them over time?
Yeah, I have a whole bunch. My wife won't let me buy another firearm. If the world is coming to an end, I might be somewhere you might want to come.
That's
Yeah.
pretty cool. Man, what's your favorite firearm?
Yeah, SR. Well, I could say SR-25. A lot of veterans will know what that is.
Yeah.
An AR-10.
Okay.
Basically, a SR-25 is similar to an AR-10 setup. That's my favorite rifle. I love that rifle.
That's cool. Did they allow you to uh, outfit them however you wanted to in the military? Or did you have to
I
follow
mean,
a
so
certain?
you had supply. You had everybody like everybody else. You had supply, and they gave you your rifles, they gave you your equipment, and everything. You had the armor room, and so you had what was available to you through the armor.
Okay. All right.
Yeah.
Something I didn't
But
know.
yeah, I mean, we painted them. We did all kind of cool features to them. You had different varieties based on whatever mission you were going on. If you needed a different rifle for whatever you were, if you were looking at vehicle-borne IEDs, obviously you're going to get a bigger caliber rifle. And so it just depends on what your mission was. But yeah, you have opportunity with the arms room to kind of get whatever they got in there. And so.
Yeah. Who do you believe in your life has made a large impact on you?
Oh, Jesus.
Yeah.
Yeah, 100%. Yeah. Following God is probably the biggest accomplishment I think I've made in my life. And, I turned my life over to him and, and I haven't looked back since. And, I can't say that there hadn't been challenges down the road with it and all and things that come up that it kind of made me question, but I never turned my back. And like I said earlier on in the interview, I'm a vessel, and I just allow him to use me to really get the word out and use my passion to help navigate and help those that need mental health care, to help them take that step. It's that first step that's hardest. If we can just get people to take the first step, then they'll get the help that they need. And I don't want to put myself out there as this big, huge, gospel. I don't go to church as much as I probably should go. I can say that I'm guilty to some of that, but I have turned my life to God and to Jesus, and I may not be the strongest follower, but He's always a part of my life.
And that's what I mean. Like from an individual like that to an individual who does go every single week, sometimes 7 times a week, and all that. They still are going to need the mental health,
absolutely,
help,
absolutely,
that there is out there, and not to feel bad, because there is that stigma,
and they shouldn't be judged.
Yeah, exactly.
Right? They shouldn't be judged. It shouldn't be judged about having high blood pressure. So why should they be judged about having mental health? I mean, your heart is just as important as your brain, right? Like you got to take care of them both. You got to take care of your mind.
Yeah, absolutely. I agree with you. at the end of every podcast, uh, I give the guests an opportunity to ask me one question. So, what would your question be?
Oh gosh, what would my question be? Yeah, I think how can we use this platform? Talking about mental health, how can we use this platform to really get that word out and that message out to people that need that message?
I think one of the biggest things is to talk about it. You know, talk about it and give examples. You're an exceptional example of not only. I'm not going to say that overcame it, but learned how to deal with it, learned how
Yes.
to incorporate it into your life, and be successful despite of it.